You're watching Let's Chat.
Founded in 1980, Alleo Health Systems, who is the parent company of Hospice of Chattanooga, knows a thing or two when it comes to taking care of our friends and family. Here to give us some information on their specialty programs is Dr. Greg Phelps. Good morning.
Good morning.
Thanks for joining us again. We spoke to you just a few weeks ago as well.
Yes. Thank you for having me back.
All right. I want to dive into the specialty programs for hospice and your palliative care. A lot of people may not know that these programs exist. Do you just want to quickly give us an overview of those?
Sure. These specialty programs are designed to help people with specific illnesses. The ones we have right now are for cardiac disease, mostly heart failure, chronic pulmonary disease, and coming soon, additional help for dementia patients that we will be able to provide.
Perfect. And of course, the names of those appropriately: Heart Touch Journey, Clear Journey, and Memorable Journey.
That's right.
Each of these is specialized, of course, to tailor those specific needs that you mentioned. You know, the heart disease, the chronic pulmonary disease, and dementia. Talk about the difference in these programs.
Okay. Well, we're trying to get past the hospice one-size-fits-all for our patients. So I'll talk specifically about the heart failure, heart touch journey. And heart failure is a process where the heart eventually weakens. Something they oftentimes don't teach medical students or resident doctors is heart failure has a 50-50 prognosis in just 5 years. I can't tell you how many patients I've talked to that didn't really understand the gravity of what they had. They said, well, I've got a touch of heart failure. And I said, well, that's like being a touch pregnant. You hang in there and something's going to happen. Yeah. And so with heart failure, with a 50-50 chance of death within 5 years, it's really important to manage those symptoms so those patients can live longer. So our heart touch journey specifically looks at the process. So often we get calls, all of a sudden, I can't breathe, I'm in trouble. But if we're talking with that patient on a regular basis, daily in fact, we can see when their feet start to swell, their weight starts to go up, and what to them is an event of, oh my gosh, I can't breathe, actually started several days earlier.
Right.
So probably the core of all of these programs is contact with the patients and their families as often as they'll let us. The other part are having appropriate medications to help with like fluid overload. So we have diuretics, we have medication to help with breathing, medications to help with anxiety. And then nurses and nurse practitioners on call all the time that they can call and say, what should I do? So they don't have to go to the hospital. Of course, one of our major ambitions is for them to have to keep going back to the emergency room for what can be long and costly emergency room visits.
Absolutely. And you've touched briefly you know, on the benefits of these programs, you know, being that constant communication, that connectivity, and not being a one-size-fits-all opportunity. I mean, a lot of times I think, especially with hospice, with at-home care, it really is a one-size-fits-all approach. And we're learning through science, through experience, that that's not what necessarily is needed for a lot of patients. You briefly touched on that, but dive a little bit more into the benefits of having this specific program care.
Well, the specific program care, a lot of people think going into hospice or is giving up.
Right.
What we hear, but actually patients in hospice on average live 3 months longer, because if their symptoms are managed effectively, they're not in pain, they're not short of breath, they're not stressed, they're not depressed, they do better. That seems almost self-evident, but it's a struggle with patients. And I'll take a moment to differentiate between palliative care and hospice, and our heart touch journey does both. Hospice is for patients who, two physicians have said the prognosis is likely less than 6 months. Now that said, I've had patients be in hospice for years.
Absolutely.
Palliative care is a bigger circle around hospice, and that's related to patients who have significant life-threatening illnesses and they are in need of symptom control. I talk about the 3 C's of palliative care. That's comfort, communication, and coordination. And the comfort is the part of palliative care that we're seeing a lot more of. But those are patients who don't fit in that 6-month window, or they're still looking for aggressive care. They still want everything that can be thrown at them.
Absolutely. Want every best possible chance.
Yes.
All right. Now, we've been talking about the Heart Touch journey, and now this is the oldest program, correct? And talk a little bit about the successes that you've seen.
We had, we were surprised even. Our Heart Touch journey for hospice had no patients go back in the first year. And we had 100 patients that had to go back to the hospital. Hospital readmissions are a major issue in healthcare, and heart failure is the most common patients. most common reason that patients are readmitted. So we look on that as a tremendous success, so much so that the cardiologist that we work with said, can you bring this out into the palliative care world, the patients who are not quite as sick, to see if we can't help some with those patients as well? So that's when we launched the palliative care version of Heart Touch Journey.
Perfect. All right, now with the Heart Touch Journey, Clear Journey, Memorable Journey, or any other program that Alleo is able to offer, how does someone get admitted and get started, and how do we begin the process?
Well, for Heart Touch, if they come in with a cardiac diagnosis, we try to get them enrolled in Heart Touch Journey. For the Clear Journey for chronic lung disease, same sort of things, calling, specialized medication, additional education. Any of our palliative care patients or hospice patients, we actually do a screening, it's in our computer system. Are they appropriate for the Clear Journey? For the Memorable Journey, we provide additional education, equipment for the families. One of the easy ones is basically an adult sippy cup, because elderly people are so prone when they're demented to spilling their stuff. We also have something that's really neat, is a weighted blanket, because people are comforted by extra weight, so it has pockets and things to do on it. Unfortunately, with COVID, we had to hold one of our things. We had a virtual reality program where a patient with dementia could go fishing right there in their bed. But we've had to put that one on hold for a while.
Something to look forward to,
I've seen the videos, and they're really cool.
Perfect. Something to look forward to, though. Of course, you're always on the leading edge of science and study and bringing the best care possible to the patients and their families. If you have any questions, you can always visit them online. You can search for hospiceofchattanooga.org, specialized programs, or palliativecareservices.org. All of that is available, and you can always give them a call as well. Dr. Phelps, we'll talk to you again soon.
Thank you very much. Good to be back.
We'll be right back on Let's Chat.